Here's an overview of my presentation. First, disclosures. I'm also in private practice. I'm a consultant to the Charlie Foundation. I have any affiliations with an institution nor commercial interests. I'm going to talk about macronutrient distribution a little bit more, micronutrients and supplements, and we're going to do a little Jeopardy. So Marianne touched on this. I'm just going to go into a little bit more, but everybody here knows from being here that this diet is about mostly fat as the main source of calories, and we have a variety of fats that I'll get into a little bit more. Carbohydrate. I like the paleo view of using just berries as fruit. So when I'm working with my patients, I ask them to start off actually with no fruit. But if we're going to use fruit and you have to have it, let's do berries, and then they can expand on that if they want to, if their glucose levels are in the range where we'd like to see them. But I really want them to focus on vegetables for the purpose of getting more micronutrients and fiber. Protein, I like, again, to look at the paleo values of unprocessed meats, fish, poultry, and I do have patients that are vegetarian, and I have one woman with breast cancer, a very rare form of breast cancer, who's vegan, and she talked her doctor into not doing the standard of care. She's just doing ketogenic, and they can't find her cancer anymore. So I have to find this woman. I started with her a couple years ago, and she's so on her own that I've lost track. But I did hear through the grapevine that she's doing fantastic, and I really need to get her published. So when I talk to people the first time about ketogenic therapies, most people have an internet knowledge of them, and they know that there's fat, and most of them understand modified Atkins a little bit. But I explain the diet by saying, now there's a spectrum of ketogenic diet therapies. The classic ketogenic diet, which was designed in the 20s, is the one that I was trained on, and we use particularly for children. So I'm showing you for 1,000 calories, the fat, protein, carbohydrate content for a particular child. Let's say this child weighs 17 kilograms. But I want to also show you other ratios. So let's say if that child was tapering off the diet, we would reduce them to a 3-to-1 over time, and then maybe a 2-to-1, and we're weaning them off down to a 1-to-1. Now, there are other reasons to vary these ratios. Sometimes it's just the child has very low energy needs and higher relative protein needs, and we can't get enough protein in a 4-to-1, so we might do a 2-to-1. So we make adjustments to individualize the diet. I don't have any adults doing a 4-to-1 diet because I can't get protein in, and they may be doing it for a week or two at a time, maybe just to charge up ketones, but I've never sustained an adult on a 4-to-1 and have them maintain their lean body mass. It's just not possible to do that. Modified Atkins, as a lot of people have referenced during this meeting, is about a 1-to-1 ratio, quite a bit more generous in the protein group. And I'll have to say, one of the problems I have with this diet is that people are usually eating this or a lot more protein since they think they can have unlimited protein. And what happens with protein once we ingest it is extra protein that we don't use for protein needs is converted to glucose, and then they complain about not getting their glucose down. So I have to kind of re-steer people that are doing this. Low glycemic index treatment is another diet that was designed for epilepsy, and the MCT oil diet, which I was also trained on about 20 years ago, is high in the MCT fats, and it's not used as much in the US. It's quite popular in the UK because the fats are covered by health insurance. And then just a regular diet for comparison. So again, this is 1,000 calories. Somebody like me is eating 2,000, so I would double these numbers. And I do follow ketogenic diets. I'm a flexitarian ketogenic, which means I can vary between ratios, and sometimes I fast. And that's what a lot of my adult patients do. I don't have them on strict meal plans like I would for, say, a child with epilepsy. So there's variations. And here's the fat percentages. Some people are more into recognizing the percentage of fat, so I've thrown those into the fat column. I thought this was very representative. I tried the South Beach diet, but I didn't read the book. For 2 weeks, I ate nothing but sand. And I find that a lot of people who come to me who are really motivated and trying to figure this out on their own kind of fall into this scenario where they're stuck eating the same things and they don't, they're tired of eating the same things and they don't really get that there's a huge variety with the ketogenic diet. They just need a little bit of education to get them there. And I also recognize the issue in the US that people are into eating not home prepared foods. They're used to eating fast foods. And this map is showing you a dot for every fast food restaurant in our country. So it's pretty sad. So, and to that point, I just want to mention one statement that I always say to people is that you have to go to the grocery store at least once a week. And for some people, that's like, oh, really? I usually go once a month. You have to go once a week because you're going to be eating more fresh, unprocessed foods. So, since most people are in tune to carbohydrate, I talk to them first about carbohydrate and how much carbohydrate. And as a point of reference, I like to just bring in that the U.S. Dietary Guidelines offers no minimum for carbohydrate. But for ketogenic diets, I am borrowing this quote from Jeff Volek, who many of you have heard speak, that the level of carbohydrate below which there is a fundamental shift in your body's fuel use away from glucose as the primary fuel, nutritional ketosis and keto adaptation. So it's individual. For some people, that may be 50 grams of carbohydrate, and for others, it might be 15 or 20. So this is an individualized diet. And by the way, I know we're bashing healthcare, and I'm right there with that. But healthcare actually is turning over to personalized medicine, and that is music to my ears because that's the way it should be. We need to personalize medicine, and there's going to be a lot more home health care, a lot more telemedicine, so people don't have to go to an institution. They can be at home in front of their computer or even on their iPhone talking with a therapist, and that bodes very well for this type of therapy. So adults, Jeff has also reported with 50 grams of complex carbs a day, adults typically will produce 1 millimole of beta-hydroxybutyrate per liter. There's not much in the literature about this. There's an abstract that I did with a physician, and we looked at a number of children on a 4-to-1 diet who were getting between 10 and 12 grams of carb a day, and they were producing between 4 and 6 millimolars of BHB per liter. So that's just giving you some ballpark ranges. But requirements, again, are individual, and as Miriam mentioned, you have to find out what people, what they want to do and what they're eating. I actually start with calories as the first step in determining a ketogenic diet. What's the caloric need of this individual? And we do have predictive equations to help with that. And then I look at protein, figure out what are their protein needs. And then their preferences. Are they dairy-free? Are they vegan, vegetarian, paleo? Are they an athlete? Because that weighs into it as well. So individualizing it. One large saboteur of the diet is non-food carbohydrates and diet beverages. This is a common beverage. These packets that are labeled sugar-free actually have a couple of grams of carb in them. So people have to read labels. Unfortunately, here in the US, if the food has less than a gram of protein or carb, the FDA allows food labelers to say 0. So that's where a lot of people miss out on significant carbohydrate. Even dairy cream, heavy cream, which we use in the ketogenic diet a lot, the label says 0 grams of carb because for the serving size, which is a tablespoon, there's less than a gram. So we look at those insidious, amounts of carbohydrate and add them up, and they can be 10 grams a day, more than the diet even allows if it's a child. Medications can be a huge source of carbohydrate, 6 to 8 grams in a syrup or an elixir. So we tend to use capsules, which are usually the lowest carb version of a medication, or swallow tabs versus chewable tablets. and liquids, which have quite a bit of carb. And then if you end up in the hospital, what do they typically like to hang in an IV bag? Dextrose, sugar. So I have taught people to be the advocate. Don't just assume that the hospital, who knows you are on this diet, is going to understand that, make that connection. You have to tell them, and then you have to look at the bag when it comes into the room to make sure that there's not dextrose in it. Propylene glycol is another version of carbohydrate used often in IVs. So these are carbohydrate ingredients commonly found in processed foods, even toothpaste, for goodness sake. Toothpaste is about half glycerin. And there are a couple toothpastes that have no carbohydrate in them. I've done extensive work for the Charlie Foundation and coming up with lists of these over-the-counter products so that we have references, and it's on charliefoundation.org under resources. So real quickly, I want to show you what happens to glucose levels, and I think I'm preaching to the choir here. You guys have heard this over and over, but I just schematically want to show you very quickly. Simple sugars raise glucose. Any amount of carbohydrate will raise glucose. Even a leaf of spinach will raise your glucose, but simple sugars raises it pretty quickly. Complex carbohydrate, not as much. Complex carbohydrates are lower glycemic carbs. Protein has a delay in the increase in glucose, and fat brings these peaks down, okay? So on a ketogenic diet, we eliminate simple carbs, and I tell people with epilepsy, if you happen to cheat on the diet by eating a piece of candy, you're gonna knock yourself out of ketosis, and that could trigger a seizure. So that's how motivated people with epilepsy are in following this diet. And to that point, I've been working in this field for 34 years. I have never found anybody so motivated to find a diet because there's so much benefit that they realize early on that they do stick with it. So it's quite amazing to work with people in this therapy. Okay, back to the chart. Complex carbs are reduced significantly. Protein typically is much less than the individual has been eating, and fat becomes the main source of calories. And this is what happens to the glucose range. It flattens out. It's very stable. And with that stable glucose level comes all types of metabolic compounds that just sort of zen out. They're not up and down and up and down, and that is believed to be part of the many benefits of the diet that you've heard about throughout this meeting that I'm not going to go into. So the best sources of carb are vegetables, again, because of the higher nutrient density as opposed to fruit. If we're going to use fruit, I like to use berries. Berries are much higher than fiber than other fruits. And also the evolution of fruit in this country, if any of you are over 50 here, might remember as a child when you ate an apple, it was probably the size a little bit bigger, like a tennis ball. That was the size of an apple, and it wasn't that sweet, it was more tart. And now apples are the size of softballs, right? And they're very sweet. So food has been cultivated, and particularly fruit, to be sweeter. And someone mentioned the other day about the season that you pick fruit in and vegetables in, there's a difference in carbohydrate content. So berries have probably been the least evolutionized because they just are more difficult to do that to, and berries are not that sweet. Raspberries aren't that sweet, right? We think of berries as being a sweet fruit, but they really aren't that sweet. Mangoes and pineapple and bananas were about this big, and now this big. You get a banana and it's 7-8 inches long, when bananas 60 years ago were the size of the length of your finger. So I spend a lot of time talking about fruit because I really want people to choose vegetables. Sprouts are an excellent source of nutrition, and I teach people about sprouting, that it's such an easy way to have a super nutritious food for pennies per serving, and it's really easy to do it. Everybody that comes into my house has to rinse my sprouts, so they get into the habit of how this is so simple. I can't believe I haven't done this. Go on the internet, you can learn how to sprout, but you can sprout many different types of seeds. They are a superfood. How much fat? So again, going back to our point of reference, US dietary guidelines say 30% of calories, and the minimal requirement for essential fatty acids, our omega-3s, are only 1% of total calories. So, well, we kind of blow that out of the water. We want at least 60%. Are saturated fats okay? I don't have to spend much time on this. I just want to point out that there's 3 meta-analyses, including a total of 1 million people, that have shown that there's no association between saturated fat and cardiovascular disease. And so our government has finally announced this. Yet on the same announcement, they're recommending low-fat dairy. I don't get it. But we're good with saturated fat. Are polyunsaturated fats okay? The main source of fat in the US diet is our seed and nut oils. However, these are also high in omega-6, and too much omega-6 can interfere with omega-3 metabolism. So what are the guidelines? I have looked high and low for what to tell people, because I think if we're going to eat most of our calories from fat, we should be kind of choosy about what mix there is. And I like Jeff Folick's advice on this. We should use about a 50-50 mixture of saturated fat and olive oil, which approximates the composition of the human body fat. And here's a chart. This might be a little bit difficult to read, but I want you to just notice the blue line here is showing us monounsaturated fats. And I don't have all fats here, but you can see that olive oil is one of the highest. Actually, safflower oil is a little bit higher than olive oil. But olive oil is an excellent source of monounsaturated fats. Somebody asked me yesterday about macadamia nut oil. It's actually even a little higher in monounsaturates than olive oil, but quite a bit more expensive. And avocado is also an excellent monounsaturated oil. But I like to get people to eat avocados and then use olive oil or the macadamia nut oil as their mono oils. So the wonderful attributes of olive oil have been published in numerous studies, and not only are they rich in omega-3 fats, but they have antioxidants and ubiquinol, which is CoQ10. So what we have to be careful with about olive oil is that it's not always real olive oil, right? So there's a simple test that you can do to determine if your olive oil is pure. First of all, I recommend the mechanically pressed, which is the extra virgin olive oil. It's the first press that's not chemically extracted like the cheaper versions of olive oil. But if you put your olive oil in the refrigerator, and you have to give it about 3 days because this takes a little time, it's going to firm up and be as firm as butter. And that's how you know it's pure olive oil. If it stays liquid, it's been cut with another oil. Typically canola oil is added to it. So you can do this at home. Saturated fats, butter, heavy cream, ghee. A lot of people like to have butter, but they don't want the protein and carb component in it, and so ghee is widely available. I love the European butters. I think they taste like a really expensive cheese, and they are expensive, but I eat them with a spoon. I don't have to put them on anything. I'll just eat them, like pudding. It really is tasty. And I was raised on butter, so I know I have this affiliation with my youth. Coconut and palm kernel oils. Any of you that may go down to the Caribbean will see the palm nuts in palm trees, and a certain variety of palm trees, and that center is where that oil is. The only place I've seen jarred palm kernel oil is at Trader Joe's, and I saw it a year ago and I haven't seen it since. I think they ran out of it. But medium chain triglyceride oil is actually an extraction from these two oils, and there's a difference between MCT oils. They're not all the same. The oils contain carbon 8, carbon 10, and carbon 12 fats. But there are some, in fact, there's a company here that makes a pure C10 oil, or excuse me, it's C8 oil, yes, are you here? C8 oil. And there's companies, most of the companies, I would say everybody else, I don't know anybody else that makes a pure C8. Everybody else has some variation of C8, C10, and there's even some that have C12 in it, which is the longer, of course, longer chain fat. So there's differences in oils, and for my patients, I like them to stick with one consistently and not switch back and forth, because it does change their ketones, and it's just best to be consistent. And in regards to protein, Miriam touched on this. If we look at what our point of reference is, the recommended dietary intakes, in 2002, the National Academies changed from doing a grams per kilogram to doing a total grams per day based on your age. And I didn't put up the whole age range chart here. I just put up the adults because I knew that was my audience. So once again, I find most people are eating more protein than they need, and protein is the most expensive macro in our budget. So this is one way to bring the expense of your food bill down, by just taking in the protein that you need. So examples up here: chicken thighs, 28 grams, 4 ounces of ground beef, 28, 3 eggs, 18, 3 slices of bacon, 8, a cup of lentil sprouts, 7. See, those sprouts also have good protein in them too. Okay, and we add this all together to get our ratio. I have a online keto diet calculator program that is free. The Charlie Foundation supports it. We do a lot of upgrades, and it's used widely for epilepsy, but my next biggest population that's asking for access are people with cancer. And I start out my patients with these strict meal patterns to kind of clue them into the food science, because they have really no idea what has protein and what has carb. And a lot of foods are a mixture of protein and carb. And who knew that you would get, for 200 grams of broccoli, which is about a cup of broccoli, that you would get this much protein? Nobody would guess that. 40 grams of chicken is about 1.5 ounces of chicken. And even butter has a bit of protein. It's not that significant, but we're looking at we're weighing out foods, and this automatically calculates out the fat, protein, and carbohydrate and calories, and we have a ratio here, and we can vary the protein and carb piece here to keep our ratio intact. But this is available to nutritionists, and then they can extend access to their patients. So supplements, Miriam talked a little bit about this, so I'm going to just briefly mention to find out what the patient is taking, and I have an intake form. It's a digital intake form. I have them record medications and supplements, because sometimes people are confused about which one's a medication, which one's a supplement, and so am I. But this is actually from one of my clients, and I thought this was interesting here. He wrote a lot of other stuff. And I said, you're going to have to give me that list. And he faxed me the list. It was too long to type out. He just wanted to save time and send it to me. But I end up usually taking people off more supplements than I'm putting them on, because people are trying all kinds of things. And mostly I'm trying to get rid of excessive carbohydrate, but also I'm concerned about interaction with this therapy. And I've noticed, having a long history of working with children and anti-seizure medicines, that in a state of ketosis, somehow medications perform differently. And often there's toxicity on the same dose of medicine prior to the diet than once on the diet. So I'm always on high alert for that, because what happens is if we get somebody that is sleepy a week or two into the diet, and everybody wants to blame the diet because that was the most recent change, and we look at their glucose and it's fine, and we look at their ketones and they're not excessively ketotic and they're hydrated, what I like to look at is what medications they're on. And Depakote, which Miriam mentioned, is a medicine that can make them feel very sleepy and lethargic, and I can convince the physician to cut back on that, and that's really the only way to determine if that's the reason. And by and large, 99% of the time, it's the medication. So we typically need less medication on ketogenic diets, in my experience. So in terms of water-soluble vitamins, I've done analyses on different ratios of ketogenic diets, and as one would expect, the less carbohydrate you have, the less B vitamins. So this is 4-to-1 is in the red column, and then 3-to-1 is blue, and on and on. So you see the columns peak up as we are allowing more carbohydrate, more vegetables, more solid food, and that is pretty obvious. So we have to carefully supplement anybody on the strictest ratio and less supplementation of micronutrients on a 1-to-1 ratio. So also, I like to think of food sources as our first source of nutrients. Everybody wants to be on a probiotic because we have now realized that the gut has everything to do with brain function, right? It's been proven. So instead of putting people on a probiotic that may or may not have the proper ingredients in it, I like to incorporate real food probiotics as well, or in addition to make sure we're getting a wide variety. Constipation prevention, Miriam mentioned this. I know constipation can be an issue, especially on the stricter ratios. Let's prevent it and not wait for it to happen by incorporating these foods early. I'll have to say avocados is probably my best defense against constipation. If I can get somebody to eat at least like a third of an avocado a day, they're golden. They go almost every day, if not every other day. But certainly green leafy vegetables and sprouts. I didn't have sprouts up here. Olive oil and MCT oil actually also have laxative properties. For metabolic support, Miriam already mentioned L-carnitine. You can get it from beef and pork and avocados. Salmon, tuna, herring, olive oil for CoQ10. And then something that has not been mentioned a lot, but I am very alert to because I've seen this happen, I've seen this out of control, and that's metabolic acidosis. And there are certain people that are more prone to this, maybe just because of their physiology, and there are medications that can cause this. And topiramate and zonisamide, which are used for seizures, so people with epilepsy, but also people with brain tumor may be on these medicines, or people with migraine could be on these medications. They typically are already acidotic. So I insist on getting at least an electrolyte panel when I'm working with somebody. And an electrolyte panel can be drawn from a drop of blood. It's probably the cheapest panel of labs that you can get. It's very easy to draw, very quick results. And you can look at the CO2 level, and if it's depressed, that means there's acidosis present. And these are just some of the symptoms of acidosis. And acidosis is the decreased ability of the kidney to excrete acid or conserve base, okay? Acidosis also reduces oxygen binding to red blood cells. So this is the lethargy that people feel with acidosis. And it also causes osteopenia. So every moment that you're in a state of acidosis, you're losing calcium out of the blood, out of the bones. So it's not a healthy state to be in. I've seen a couple of patients with severe acidosis, and they are cuss-mauling, and that is a rapid, shallow panting, kind of like a dog panting, okay? Not a good state to be in. And these are very sick people that were without food. And this needs to be corrected medically. They need to get into an urgent care to have this Kussmaul's respirations treated. So buffers to neutralize acidosis, water is the best buffer, and I'm getting a flag here, so I'm almost done. But water is a great buffer. You need to drink about 2 liters of water. There are potassium bicarbonate buffers and phosphorus. I actually have a little recipe for these. And then, well, okay, should we do Jeopardy instead of a question? Because this is kind of fun. All right, so in Jeopardy, for those of you that don't watch Jeopardy, they ask the question first, right? So the question is, or they provide the answer, excuse me. The answer is, which one is ketogenic? 1 or 2? 1. This is almond flour, eggs, and olive oil.
Oh, that's not fair. You didn't give us the recipe.
Is it 1 or 2? 2, yes. This is, I put the recipe there. Mac and cheese, 1 or 2? Spaghetti? Spaghetti squash, right. And I want to thank the Charlie Foundation. This is Charlie, who's a grown man, and his life was saved with the ketogenic diet. He had the worst type of epilepsy, would have ended up in a wheelchair with a feeding tube had it not been for his family pushing to get him on the ketogenic diet. And he is taller than all of his family. So the diet does not permanently stunt the growth of children, as everybody worries. That's why I like to show this particular picture. So with that, I will take questions.
Okay, very naive question. You talk about sprouts. I assume that all sprouts are equal. So if you have seeds, for example, from butternut squash, which is a vegetable that's not great for this, is a sprout from those seeds also less good?
So I would not recommend you just taking the sprouts out of your squash and sprouting them. Is it less good? I don't know. I've never sprouted butternut squash seeds. I always buy my sprouts from a supplier because you need a lot of them. Okay, but they're probably good. I don't know. I haven't evaluated them. They're probably higher in carbohydrate than.
Basically.
Oh yeah. They're higher in carbohydrate. So lentils, I've sprouted lentils, which are higher in carb, but even with that, some of that carb is fiber, and it's a low glycemic carb. So yeah, the vegan that I worked with eats one of her whole meals is just sprouts with olive oil and avocado on the side. And she's getting a good dose of protein. She's probably getting 8 grams of protein in that one meal and a few grams of carbs. So still fine.